When COVID was first identified and began to spread in the first months of 2020, and then March the 11th, 2020, the WHO declared a pandemic. The two countries were in very, very different positions. So when did they start to prepare for what was coming?
Well, in Central America, as you know, there's a regular experience with pandemics, or rather epidemics of various kinds, chikungunya, dengue, at times malaria, and so on. And really, the community-based health service, which Nicaragua had been developing, particularly since 2007, has been designed to address those sort of epidemic conditions. So there were already, it's based partly on the Cuban system, where brigades of health workers go from door to door, offering vaccines, checking up on people. Not as intensively as happens in Cuba, but there were very intensive vaccine campaigns. I mean, I've been vaccinated at my doorstep, as it were,
right,
against influenza and against lung diseases, more than 2 or 3 times in each case. So there was a system that existed to get to people locally. And once the health ministry realised that the epidemic was turning into a pandemic, which was at the beginning of 2020, it began to plan in the way that it would have planned for other epidemics. So all of the 36,000 health workers were trained about how to deal with COVID, and their training continued as more was learnt about COVID. Health brigades began visiting houses, and in the end made about 5 million house-to-house visits. And they began to equip public sector hospitals. So one small hospital was turned over entirely to COVID and chest infection cases for the pandemic, and another 18 were prepared with isolation wards where COVID cases.
If I can just jump in there, I mean, that's a fascinating statistic you've just put in there, 5 million household visits, but you told us the population of Nicaragua was 6 million. So that must be 2 or 3 visits per household or something like that.
Yes, as many as some households have had 4 or 5 visits.
Right.
So, and this was part of initially it was about countering misinformation. So it was about telling people how to prepare for COVID, how to identify COVID and what precautions to take. And then, of course, eventually when vaccines became available, much later than they were available in the US or UK, or several months after that, they were the basis for the vaccination campaigns, which have also been successful. We'll talk about in a moment.
So you had this really integrated community-based healthcare system, which the Sandinista government had established, which enabled people. I suppose one of the main things we saw in a lot of countries around COVID was fear, because people didn't know what this disease was. They were frightened of it, and the media obviously whipped that up as well. But obviously, having these visits from health brigades must have been quite reassuring for the population that, the government was on the case. They understood what this was, and they were going to be informed as to what steps they could take.
It should have been, and I think eventually it was. The problem was the way that the pandemic was politicized. So immediately the right-wing opposition groups started to criticize the government, saying that it was unprepared, that it was denying the existence of COVID. And then once cases started to appear, I think the first case was in the middle of March, they started to say that people shouldn't go to hospital because if they went to hospital, they wouldn't come out, or they'd only come out in a coffin. And so there was this fear around the pandemic generated through social media.
Okay, so you had this politicization coming around the initial discovery of cases. You had the opposition to the Sandinista government saying that, that the government wasn't owning up to the severity of it and advising people not to go to hospital. So, and then you had and as that was happening, and from what you're saying, in March 2020, obviously around the world, many countries were entering lockdown. Most countries were entering lockdown. So what was the Sandinista government's response in Nicaragua?
Well, it really had to make a decision about whether to go into lockdown or not. And it took the courageous decision not to go into lockdown. And I think, in a sense, it was the only practical decision, because so many Nicaraguans depend on their small business activities to put food onto the table every day.
Yeah.
They live a kind of hand-to-mouth existence. That's a bit crude, but you know what I mean.
It's the informal economy. That's
yes.
what the majority of the world works in. Yeah.
Yes, and here the big business part of the formal economy is relatively small. It's I think less than 20% of economic activity. So the size of the small economy is it's difficult to judge, but it's well over 50% and probably higher, quite a bit higher than that. And so the government decided that a lockdown was impractical, and in any case would have been very difficult to enforce. Partly because the police would have been very reluctant to take harsh measures against the population to enforce it, and partly because Nicaraguans are fairly rebellious in this sense, and would have probably.
But I mean, this is interesting as well, because you told us before that the police was, again, community-based policing, and so presumably one of the reasons why a kind of authoritarian, harsh political framework such as a lockdown wouldn't necessarily work is precisely because of that.
Yes,
police.
That was an important reason. Another important reason was that we're talking about 2020, and the violent coup attempted occurred only 2 years before. So, of course, the economy was still recovering from the damage that had been done then. And It was obvious that a lockdown would cause even more damage. Of course, the pandemic did damage the economy, but a lockdown would have done even more damage to the economy.